Welcome to another episode of Ask Plexus DX. Today we're diving into a really interesting topic. What's the most effective genetic test available for monitoring blood sugar levels? It's fascinating how our genetic makeup can influence so many aspects of our health, including how we manage our blood sugar. So let's break it down a bit. Blood sugar levels are affected by a mix of factors, like what we eat, how active we are, and yes, our genetics. Genetic testing can actually reveal specific markers that show how our bodies process glucose and respond to insulin. For instance, variations in genes like TCF7L2 and PPARG can increase the risk of developing type 2 diabetes and insulin resistance. Understanding these genetic factors can be a game changer for managing your health. I remember working with a client who was really struggling with her blood sugar levels. She was eating healthy and exercising regularly, but still had issues. After some genetic testing, we discovered she had a mutation in the GCK gene, which plays a key role in glucose metabolism. Armed with this information, she was able to tweak her diet, and guess what? She saw significant improvements in her blood sugar management. It's amazing how knowledge can empower us to make better choices. Now, if you're considering genetic testing for blood sugar assessment, there are a few options out there. Tests that focus on diabetes risk can help determine your likelihood of developing insulin resistance or type 2 diabetes. The TCF7L2 gene is often a focal point in these tests because it's been extensively studied in relation to glucose metabolism. Another option is the MTHFR genetic test, which looks at variations in the MTHFR gene. While it doesn't directly impact blood sugar levels, it can affect your overall health and metabolic processes. And then there are comprehensive metabolic panels that provide a broader view of your metabolic health, including how your body processes carbohydrates. So, how do you choose the right test? Here are a few tips. First, definitely consult with a healthcare provider. They can guide you on which tests are best for your specific health concerns. Second, consider your family history. If there's a history of diabetes, specialized testing might be a good idea. Third, look for comprehensive testing options that evaluate multiple genes related to blood sugar control. Fourth, check the credentials of the testing provider to ensure they're reputable. And finally, once you get your results, work with your healthcare provider to create a personalized health plan that includes lifestyle changes. In conclusion, understanding your genetic risk factors for blood sugar imbalances can really empower you to take control of your health. By exploring genetic tests that assess diabetes risk and other related factors, you can gain valuable insights into what your body needs. And speaking of insights, if you're ready to take a step toward better health, check out the innovative precision health and wellness genetic tests offered by Plexus DX. You can find them at plexusdx.com, Amazon, and walmart.com. These tests can provide you with essential information to make informed health choices. Thanks for tuning in to Ask Plexus DX. If you found this episode insightful, please like and subscribe. Remember, links to Plexus DX tests are provided below in the show notes. The following is an important disclaimer. Plexus DX is a personalized health report and laboratory testing service, which enables users to obtain science-based, evidence-backed health and wellness information based on their genome. Always consult a licensed healthcare provider for concerns about your health and before you stop or start any medical treatment.